circumstances that we've all dealt with. Unfortunately, we haven't been able to meet as a committee, and there's some things that need to be discussed later on. Once we get through our normal business, there's going to be a lot of financials to review from February all the way through April. Same with the reporting from Lockton. We'll have to go through that. And then when we get into old business, there's something to discuss on the HRAs, and then new business. I know Cigna has a presentation on the Embark Benefit Protection Program on the gene therapy. And then also I asked Julie if she would go over the annual report that we had from Cigna, and I believe that meeting was dated back in February. It was February 13th of 2020. So just kind of give you an update of how the plan ran last year. Keep in mind when we get to that point, we did make some significant changes last year to the plan. So we'll go ahead and get started. If everybody has a copy of the February 26th meeting minutes, if everybody wants to review those, if they see anything or anything from there that we need to make changes on, we can get that done.
I make a motion to approve them.
I'll second that.
Mike Labor made the motion to approve them. Jim made the second. All in favor?
Aye.
Aye. Aye. Sounds like everybody.
Aye.
Cool. We'll move on to the finance report. Kimberly from finance, and I'm sure Brian, you might be able to chime in and help out a little bit. Remember, this is February, March, and April, so we will probably have to go through and make a motion on each of the 3 months. I don't think that we can actually go through and do all 3 months as one motion. So, Kimberly, I'll let you have the floor, and if you want to walk us through it, we can go from there.
I don't hear her.
I don't either.
Yeah.
I don't either.
Says she's on here.
You have your mic on, Kimberly?
There you go. Hi, Kimberly.
Sorry, my internet dropped, so I had to grab in my phone real quick. Let me get my picture on there. There we go. Sorry. Of course, it always drops right at the right time, so I have the app on my phone too, in case. I presented the financial statements for February, March, and April. As I documented in the corresponding report, there's the various losses or net income for the month. But overall, through the month of April, for the 10th month of the fiscal year, the plan is experiencing a total loss of $326,280. And the ending unrestricted net asset balance is $3,252,413. So if you look at that from where they started at the beginning of the fiscal year on July 1, you're about $100,000, almost exactly $100,000 less than when you started July 1. A couple things, a couple things to note. The IBNR was updated as of March 31st, and you will notice at the bottom of the statements in March and then again in April, there is a decrease to the IBNR. It went down from December 31st, it was 2.2 million, and it went down to 1.9 million. So that kind of helps your fund balance too.
Is that going to be related a lot to us not having the clinic anymore?
I don't know a lot about how that's calculated. That comes from Lockton, and I don't think that really has much to do with the clinic, as far as I know, because it's going through they run reports from Cigna. So I don't know if Amber can talk about that a little bit more. But I wouldn't think that would impact that much.
Yeah, I don't think the clinic has the IBNR is more of just the claims run out through the actual plan through Cigna. So I don't think that has any bearing or much of any bearing on it.
Would it have to do? Would it? On that note, would it have anything to do with us not having the post 65s? With them being separated out, since this is the first time the IBNR has been changed since the first of the year?
Well, Dina, correct me if I'm wrong, but wouldn't we still have some run out from those post 65, so we might not see the full impact right now? She may not be on. Because I think there's still some run out from there could still be a little bit of run out from 2019. So I think we'd have a better idea of that once we get to Q2 of 2020.
Okay.
I thought normally the runouts are pretty much done though by this time of the year.
Well, they should be there, but we've got 3 months we use claims through, it was IBNR through March, so there may be, it could be, I mean, it should be pretty well wrapped up, but there could be some run out.
Gotcha. But it could be like it might be on less than a handful of claims.
Yeah.
The only other question, the question I had, Kimberly, that really caught my eye is when we were looking at the very front of the finance report, the month of February, OAP1 had a net loss of $615,000. Is that basically just because of the claims that were paid out from the end of last year?
Well, if you remember in January, they withheld claims for the new plan year. So I think you saw some carry over into February. Mm-hmm. And if you look back traditionally the winter months, usually January, February, March are kind of higher months, just flu season, that kind of thing, it seems like. So I think that's more just kind of some carryover from January that didn't get reported would be my guess. There any other questions?
No, thank you, Kimberly. It's nice to see you again. I make a motion to approve February financial. I make a motion to approve.
Well, hang on, we got to do one at a time.
Oh, we can't put the 3 motions out there and then approve the 3 motions?
How about a motion?
I think you should do it one at a time.
All right, boss lady.
So I've got a motion.
I'll second the motion for February.
Jim, second for February. All in favor, say aye.
Aye.
Okay, February's approved. We have a motion for March's financial report.
I'll make the motion to approve March.
I second it.
Motion made by Jim, seconded by Mike to approve March's financial report. All in favor, say aye.
Aye.
And for the month of April, we have a motion.
I make a motion to approve April's minutes for financial secretary.
A motion made by Mike. Is that a second by Jeff?
Yeah.
Okay, seconded by Jeff. All in favor, say aye.
Aye.
Wait. Finance is done. Thank you.
Okay, thank you. Have a good day.
You too. Update from Cigna. Is Lisa on here?
Good morning.
Good morning, Lisa. How are you?
Good. How are you?
I'm doing well.
Good. Right now, I don't have much of anything for you all. It's just the typical questions regarding the health insurance claim issues. As far as the COVID, surprisingly, I didn't get any much questions or concerns about that. But no, just juggling between kids and work. That's it.
Thank you.
Did we have any cases with our membership with the COVID? Just curious.
Mike, you want me to take that? It's Julie.
Yeah, that's fine.
Anybody can take it. Does anybody know if we had any COVID claims from the membership?
So, Mike, we had, this is Julie from Cigna, and we're running reports on COVID-specific claims. And what we've seen so far is about $2,000 in claims. And so one individual was impacted. And I'm going from memory, so I'll pull it up and just make sure I'm remembering right. But
that's a blessing to hear. And hopefully it was just for testing and not, put in the hospital.
I know Brian Kidney sent out an email, I believe the end of last week. It said that Yeah, what Julie is saying is there was only about a $2,000 impact on the plan from anything that was COVID related. So that's great to hear. I'm glad everybody's staying healthy, and that it's working for us.
It's good news.
Okay. Lisa, do you have anything else? Guess not.
She had her
We're
mic
rookies at
muted,
this.
Do what?
She had her mic muted.
Oh.
Can you hear me?
Yes,
I'm
we can
fine.
hear you now.
No, nothing else.
Okay, thank you.
Thank you, Lisa.
You're welcome.
We'll move on to the Lockton report. I think Dina's on here, but Amber.
Yep. Dina texted me and said that she's having problems with her mic on her Surface. So, so I guess we have 3 months of experience to review. So you can see, I'm just going to look on the first page. Total plan costs for for February were about $2.2 million. And if you look at that compared to funding, there was a pretty big funding difference. But as we talked about, as Kimberly already alluded to, Cigna had those claims kind of pended. So that's a little bit of a misnomer there as far as how the month actually ran. Claims obviously looked a lot better in March at $1.22 million compared to funding of 1.4. And then in the month of March, we had Medicare D subsidy payments of about $57,000, and then RX rebates of about $359,000. So that helps that month look favorable. So for the month of March, we had a funding surplus of $249,000. And then for April, total plan costs came in at about $1.39 million compared to funding. So we're looking at a year-to-date funding deficit of $508,000. As we always do, just for the plan, for year-to-date plan costs, you can see we're at $1,376. If I did my math right quickly, looking back on my teeny little screen, last year we were at $1,110. So quite a big jump there.
Did you guys send that report out to everybody? Because I don't have their report.
I sent it to Mike.
Oh,
I don't have it either.
Okay.
Sorry, that was miscommunication. I didn't know whether Amber was going to send it to everybody or if I was supposed to.
No, yeah, sorry about that, Mike.
Rookie.
Hey, I'm learning. This is only my second meeting. You got to give me a break.
Mike, we'll take the blame together, okay?
Sounds good.
We can send that to you guys as a follow-up. I'm so sorry. And then as far as large claimants, sorry, I'm looking at my teeny little phone for all this information. So through March, we have one member who has claims over $150,000. It's an employee on the OAP1 plan, and it is chemotherapy, and their total paid claims year to date are $218,000. So of course that hasn't hit. It hit in March, but there's no claims that have gone the specific deductible. And then through the end of April, there are an additional 3 claimants that are between that $100,000 and $150,000 threshold.
Amber, can you give me the EPM again for
let me double check that so Mike can send that out and make sure that it's right. But for last year or this year?
What was the number for this year again?
For this year, for year to date, it's 1,376.
Oh, that
so it went from
nice.
it went from 1,000 to 1,300.
Correct.
And Amber, I pulled up the email, and I'll take the blame for that. That's my apologies. I misread sending that out. So I will forward that to everybody on the committee here. Let me see if I can actually do this.
Amber, what do you see that caused that kind of jump?
Julie, I might have to have you chime in to see what, to see if you know what happened behind the scenes on that. It's unfortunately, I'm looking at just one teeny little screen on my phone. So Julie, do you have any intel on that?
I don't have any specifics. I can try to pull a report while we're talking.
Okay.
But yeah, I don't have any specifics. Would assume it's large claim related, but I don't have anything off the top of my head at the moment. Let me see if I can pull something while I'm talking.
Dina's calling me, just a second. Let me see if she can chime in. Hi, Dina.
Okay, it's somewhat to be expected because
I have her on speaker, so can you guys hear her?
Yes.
Mm-hmm.
Okay, it's somewhat to be expected because with the retirees coming off, we have more members per employee. So that's going to increase the PEPM per employee. So if we looked at it on a membership basis, it might not be as big, but we took a lot of individuals and spouses off the plan and left the families on the plan. So the PEPM will increase for that reason.
Okay.
Well, are you saying because it's a smaller pool?
No, we're measuring it based on employees, and if you take off employees that are like employee and spouse or employee only and leave on families of 4, 5, or 6, those 4, 5, and 6 members are going to cost more than an individual or an individual and a spouse.
Okay, I get it.
Thank you, Dina.
Sorry, my mic's not working.
Hey, can I ask a quick question?
Of course.
Do we think that because the hospitals and doctors basically were shut down in March, April, and really the 1st of May, do you think we'll have a big onslaught of claims come 1st of June, July?
So I can take that, and then Dina and Julie, you can chime in. So we are expecting deferment and care throughout this. I think it's like the end of March and April. So we are expecting a deferment and care. You could go either way on, well, there's 2 different theories on whether or not we're going to see a surge. So some treatments you're just not going to be able to make up, and some you are. So Dina, do you have any more specifics or any more clarity or clear?
So yeah, some treatments, like if you have a quarterly appointment and you miss that appointment, you're never going to make that up. So those will be avoided care. And then other things will just be delayed or postponed that weren't emergencies. So we are anticipating that there will be a little bit of an uptick as the world resumes a new normal, but we'll never catch up with what we thought would have happened had we not had COVID-19.
I would think our claims would get a little bit better. I don't know that it'll increase too much because a lot of doctors, if you just had doctor's appointments, those were still doing telehealth.
Mm-hmm.
So a lot of those appointments still went with telehealth because I had several that way myself.
Yeah, and this is Julia. At some point, there's a capacity issue, meaning that there are only so many doctors and so many appointments, and so many facilities and surgeries, and so you can't really, everybody can't go back and get everything done because there's a capacity issue as well. So I agree with everything that everyone else has said. I think we see a bit of an uptick, but I don't think we're going to get. We're going to get back to what was lost just because of all of the factors already mentioned.
Update, I went ahead and forwarded the locked-in experience to everybody. If somebody doesn't get it, let me know, and if you need a copy of it, I can get you that. We'll send out. But everything, it should be emailed out at least to all the committee members, and then any of the directors. I know Jennifer's on here, Brian, and make sure to include it to Adam as well, so that it could get to the city manager's office if they need to look at it as well for any reference. So, any other questions for Lockton?
I make a motion to accept Lockton's report.
Okay.
Second.
We'll have to do it the same way. We did the finance
For February.
Okay, so Mike and Jeff for February. All in favor, say aye.
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 February's approved. For March.
I make a motion to approve Lockton's March report.
I'll second.
Motion made by Mike, seconded by Jeff. All in favor, say aye.
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 March is approved. April.
I make a motion to approve April's Lockton report.
Second.
We have a second by Jeff. All in favor, say aye.
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 I feel like
Hey,
it's
Mike.
Christmas and I got 3 approvals.
Your time's coming, Amber.
I know. And Jill, all I can, right?
Hey, Mike, the only thing
Yes,
we
ma'am.
got was April experience.
Yeah, it's all included in there. When you go back and look through the actual plan deal, it breaks down
Okay.
through the
By
chart,
month.
through the, I think, the 10 or 11 pages. It breaks
Okay.
down February, March, and April in there as well. So the front page of the experience was only for April. So
Do you
Okay.
need, Mike, for purposes of minutes, do you need a cover letter for February and March?
it probably would help. It'd probably
I
Okay.
be
think you
efficient.
should. Yeah.
Okay,
So whenever you get that, Amber, if you could just email it out to the entire committee.
entire group. Okay, you bet.
Yeah. Thank you. And Terry, we could just include that in the minutes as well.
Okay.
Next on the agenda is an update from HR. Terry or Jennifer?
I don't really have anything major. Do you have anything, Jennifer?
I don't at this time.
Okay.
Just lots of normal stuff.
What's normal anymore?
Yeah, I don't think
Lot of
anybody knows what
changes.
that is.
Yeah.
Next on the agenda would be wellness. Selena?
Hi.
Morning, Selena.
Morning. Okay, well, there's not too much going on either here. I will say we did yesterday, we got in the hand sanitizers and hands-free hand sanitizers and the hands-free door pulls that you use your foot on to open doors so you don't have to use your hands. Most of the time they're in restrooms. So I sent out an email about maybe a month ago or a little more to all the coordinators in the city about if their departments needed sanitizer or these door openers. And so we went ahead and purchased them, and then we got them all out yesterday to all the different departments that ordered them. And I think Public Works is going to work on putting them up. I know the goal is to get them up before June 1, or at least as close to June 1 as possible, since that's when the city's going to slowly start reopening and the community will be in there and more employees will be in. So we got those out yesterday. We have also, yesterday we did a lunch and learn with Mandy. She presented from Cigna. She presented on what Cigna has to offer as far as mental health programs that Cigna offers the employees that are free of charge. And then when I get a recording of that, I'm going to send it out to the employees and also include their Sudden Link EAP as well. And then I know Chase during this has been doing some videos on the YouTube channel for the employees to kind of keep active as well. So we've been promoting stuff and really just for the past 2 months been pushing kind of the new stuff that Cigna would cover, all the COVID stuff, and just making sure the employees knew what their insurance would cover during all of this, the telehealth and all of that. So not a lot happening here. And then I think Mandy's going to talk about some of the things we've kind of been working on with biometrics. So we'll go more into that. So that's about it.
Real quick, is there any way to track, have we seen a huge uptick in the telehealth? And I don't know if that's something for Julie, if she'd be able to answer, or Selena, you could answer that.
I can't see if people went telehealth. I mean, I can just see if they reported that they, went and got like a doctor appointment. I can just see if they got that done, but I can't see telehealth or not. That would maybe Julie.
I was on mute. So I can run a report to see do you guys want to know telehealth in general or just COVID related telehealth? Because it is on my COVID reporting.
I was just curious. It'd be interesting to see both, but especially, are people really starting to utilize a little bit more of the plan and the options that we have with the telehealth and everything like this, since they haven't been able to go to their doctor. So
we generally have seen an increase. I can find out specific to you guys just to see.
I think it's great that, obviously not this happened, but that it kind of forced everybody to use the telehealth, because whenever we would go around and do the presentation on what the insurance offers, we had very few people that ever utilized telehealth. And so this will be a good way to kind of remind people that we have it, and there'll be a lot more people that have experience with it, I imagine, now after this. So
yeah, and I'm not seeing through April for COVID, I'm not seeing any telehealth visits, but I can pull just in general for you guys and send that out to the committee.
Okay, yeah, I think it might be. It's like Selena said, maybe with these times, maybe we can get some benefit out of this, and people are utilizing that a little bit more than what they have been in the past. So,
Julie, do the doctor's offices have to code it as a telehealth visit?
I believe so. I know COVID related, we set up specific codes. And so that's how we can get the reporting. That for telehealth, I do believe they have to code it a certain way. And, we just recently with COVID started allowing all the providers to do that. So
are those visits cheaper, or do they run them the same?
I believe that if you use MD Live or Amwell, those would be, again, per the plan. But I don't think there's a difference in a telehealth visit with your primary care versus live.
I did, during all of this, I did telehealth physical therapy like 4 different times during COVID. And it does show that it was virtual. Whenever I look at my own claims, I can tell. And the cost looks similar. So. But that's all for wellness for right now.
Okay. Thank you, Selena. We'll move on to old business. I know I had Alicia put this back on here, kind of our continued discussion. We were in the process. We had decided on a provider, and we were waiting to hear back some dates and everything like that from our biometrics, our HRA screenings. So I know we were hoping to have that done by now, but with everything going on, Selena talked to me the other day about it. I believe Mandy was going to talk to us about some of our options of what we could do from here on out as far as our biometrics. So I will turn it back over to Selena or Mandy.
Yeah, and Mandy is on speakerphone because she can't get her audio to work. So we're going to see if she can talk through my phone like Dina had to do.
I'm going to set this.
Can everybody hear me right now?
Yes.
Okay.
So there are a couple more options if we don't want to do an on-site biometric screening. There's the retail option and then the at-home option. The retail option is one where participants will just register online and then go to an affiliated Quest Diagnostics location, which there's like 2,200 around the United States. So there's going to be plenty in the area. Wherever they live or work, they should be close to one. Excuse me. So while if this is an option that you guys want to do, it's a pretty simple option. It's actually billed at an as-use basis, so there's no setup time, there's no minimums to meet, there's not a separate cost to setting it up or anything. It just is, it's simply just having whoever goes into the patient service center, depending on what biometric screening you want them to do, they'll register online, they'll set up their appointment, and then they'll go in. So it would be covered under claims. There shouldn't be any sort of cost outside of what's called a fallout. So if somebody were to enter their name or member ID incorrectly and it doesn't match up with the Cigna feed that Quest has been sent from us, then that's what's called a fallout, and that would be billed directly to you guys. And then I have had some success with getting those ran through claims kind of the back way if there is a fallout. But fallouts don't happen very often. But that would be the only cost that would be associated with the patient service center. There is also the at-home screening option where participants are mailed the home screening with instructions for secure processing. There is, if you want to send this out to every employee, there is a $6 per home screening mailed fee, and that it would be covered. That wouldn't be covered by claims. So that would be either Staywell funds or wellness funds. And then there's every kit that's returned is what would be charged toward claims. So those are the two options without having to do an on-site biometric screening that are available to you guys right now.
And Mandy, they could still do an on-site. It would just have to be later in the year, correct?
Absolutely. Yeah, Quest is still doing on-site biometric screenings. They say that they take the social distancing precautions, and they have been this whole time. It's just that nobody's been on-site to do on-site screenings. So that's still an option for you if you prefer to do that.
And we can send them to their, always send them to their own primary doctor to get them as well. So that's always been an option. So the reason this came about was, I know we had already decided to do the on-site, but now with the limitations of how many people can be in a room for a certain amount of time, when is that going to be lifted? In order for any of this to go through, for our wellness program, it has to be run through by October 31st. So the later that we push the on-site biometric screening event, the closer it gets to that October 31st date. So I kind of talked with Julie and Mandy to see if there were other options that we could present to you guys to see if you guys still wanted to do the on-site. That was fine. We can move forward with that, pick dates, kind of, I guess. And then, or if you guys wanted to look at some other options, like just sending the employees to Quest or just sending them to their primary, which that might be a problem too, because I don't know how many people can get in with their primary, in the next few months. So just to present you guys with a few more options.
Another option, sorry to break in here, another option is that we can move the deadline also.
Yeah.
To like 12/31, if you wanted to give a little bit more time to get these screenings done.
I personally think you do need to move the deadline because of the environment that we're in, and you know, it give everybody ample opportunity.
Sure. If somebody wants to give send Selena an email or myself an email, Julie an email, just kind of putting it in writing, the deadline that you guys want to move it to, then I can go ahead and get that in the works. If you want to move all deadlines to 12/31, or if you just want to do the biometric screening to 12/31, just let me know and I can get that done for you.
What other deadlines would we be up against as far as other than the biometrics?
It's all the claims driven things. So if anybody were to go to their primary and get a physical, or if you were going to get your, say, mammogram or any of those, they are all, the reason that it's been October 31st is because it can take up to 6 weeks for that claim to go through. And that way we would have everybody's information by the end of December in order to get them their time off early in January. So anything that's run through a claim has a deadline of October 31st.
What's the committee's consensus on moving the deadline from October 31st to December 31st? Do we move it back 2 months or do we move it back a month? What's everybody think?
I think the December 31st is fine by me.
Yeah, I agree.
Okay. Selena and Mandy, I'll send you both an email here shortly and make that request that we move that deadline back to December 31st for all services.
Can I ask one question? All right, Julie was mentioning the option through Quest of the 2,200 sites or what. Who's that through? Is that through Quest or is it through like one of the drugstores like CVS or whatever? Or is it? So I'm not understanding. Does Quest have sites here through town, little mobile units or something? Or
they're like brick and mortar stores you can go into.
Really?
And basically what they do. So we have this through Cigna. We could go on to the Quest Diagnostic website, put in a username and a password, and I would just sign up when was convenient for me to go in. And I would just go into the Quest. I live in Blue Springs, so I just went into the Quest that was here in Blue Springs, and they just, draw your blood, height, weight, and they send it all in. So it's
how long does that take to go through?
You pick your time. So if I pick 7:15, I get there at 7:10, and usually they're pretty quick on it being 7:15. There's no chat about. The only thing that's different about that and going to your primary is you are, talking with your doctor about other things that, you might need to discuss, and they can go through that with you. Whereas this is basically you're just getting your blood work done in and out.
But aren't we pushing for the biometric tests? And if the person was to do, like in your case, Selena, if you say you went last week, how long is that going to take to go through then? Does it take the 6 week claim?
So we always tell people give it about 6 weeks, but it doesn't necessarily take 6 weeks. I mean, you can see your results within 2 weeks. And then when you have that Quest username and password, all your results will come up there. Your doctor, you can have your doctor get these as well. But you can go on and look at your Quest. You can look at your results on that Quest website.
Well, did you feel comfortable doing it that way?
Yeah, I've gone to Quest a lot for a lot of things rather than going in. Whenever I had to have blood work or any numbers done, I just go my doctor will just send an order over to Quest, and I just go in and get it done rather than going in and having to do a doctor's appointment if they just need blood work.
I do the same thing.
Mm-hmm.
Yeah.
Well, is this an option we maybe should think for the membership then? With the way the times are going and everything? If we're going to try new things, this would be a way to push people towards it.
Well, I think even the doctor's offices right now would prefer to not have people there. They're still trying to limit how many people are coming in, and you have to go through all of the screening and stuff to even go in. So if you can push some of that out to places like Quest, I think it's better because you are setting your time and it's just easier.
Well, yeah, and we don't get into the habit of what people used to say about the clinic. Well, I can't get in, or, to do my HRA or all of that stuff. And so, I mean, I know we have this option, and it kind of sounds like something we should try to maybe push and promote. I don't know. What do the rest of you think?
Is my microphone working?
Yes,
Yep.
Jamie, you're working.
Okay, I agree with Mike. I do the Quest too, and it's easy. Usually within 5 days, you can get a 7:30 appointment.
Mandy, real quick, from a financial standpoint, what's the price difference between doing the retail option where everybody's registering online and going to Quest versus bringing them? What's the big price difference on that?
Right. So now, if I remember correctly, you guys wanted the HDL in your reading. The price difference is actually in terms of claims. It's going to be about $10 or so cheaper per claim going through the patient service center than having an on-site screening. And then once again, those extra fees, after-hour fees and unmet minimums, that sort of thing, that wouldn't be a problem for this type of like going through the patient service center.
Well, when you talk after-hour costs, is that if we scheduled an in-house, have people come in and do it versus the Quest stuff? Because I'm sure these Quest buildings have hours.
That was we had an after-hours cost that was attached to it because we were trying to make sure we covered as many employees as possible. We have like PD officers that are working night shift. We have, other services throughout the city that are working. They don't work the typical 8 to 5, so we were having to pay extra
I got
hours.
you there.
So we're saving money on that end of the deal too. And then I think it kind of opens the option for everybody to go in at their own convenience versus having to do it.
Exactly. As long as they know they have to get it. I mean, this option here it opens up, gosh, many options of having an appointment.
Mm-hmm. And Selena, couldn't you send out like a informational piece that walks them through going through the Quest? Setting up the name and password, and so it step by step tells them how to get this thing done.
Yeah, we definitely would send that out. Some educational piece to the employees, a reminder to do their health assessment, their Cigna health assessment, and then also we can send out a kind of a link or something as well to the employees that tell them where all the locations are, but it's not hard to find them, but even the one within, I think the one in Centerpoint, there's a Quest Diagnostic in Centerpoint. So that's a local one. And then, like I said, I know there's one here in Blue Springs. So we could send all that out. And then, I know for wellness, we're really just trying to capture the employees, but this also makes it really easy for everybody who's on the plan. So anybody else who wants to get their biometrics, any of the spouses that don't work for the city, they can go anytime, to any of the Quests and get theirs as well. So.
And this is covered by the plan, right?
Yeah, it's run through your insurance.
Mandy, what's the lead time to get this set up if we were to go with this option?
I'll have to double check, but I believe that as soon as we get send the request to Quest, because we are partnered with Quest, they have the data feeds ready, and so it could be going within probably 2 weeks, I believe. I know I have another client who is switching to this option. They didn't even sign an agreement with Quest, and they're already signed up or they already have the ability for their employees to go in and to any patient service center. So I haven't been able to speak with anybody at Quest quite yet to get the details on the lead time, but because we are partnered with Quest, they have those data feeds already. So it wouldn't be like a scheduling, 6 to 8 weeks sort of lead time like the other one.
This is sounding like a really good option, guys. What does everyone else think?
I agree.
I agree.
I agree with you.
Where is the location of the Quest and Independence?
It's in the office building, Center Point, the third floor.
There's also one just south of 40 Highway, right there. If you're going south on 470, you can see it right there on the east side, south of 40.
It's back there behind Quick Trip and all that, and those medical offices back there.
Well, there's got to be quite a few if there's 2,200 or over 2,000 sites available here in the metropolitan area. I mean, that really gives even all of our out-of-towners a chance to do this.
Well, and I'm on the website now, and there's 29 spots available today still. 33 tomorrow, 35 Friday. But that could be because of what's going on.
Well, what's the committee think? And I think it's something we definitely should entertain.
Do we need to make a motion?
Yeah, we're going to have to make a motion because it's changing. There's going to be money that changes hands. We'll have to include the motion that we don't want to do the on-site anymore because of the restrictions, and we're not able to, but there's the option of the retail to register online and go to Quest in person, and that, it'll be covered. I can explain all that to the city manager's office when I send that recommendation. But yeah, I think we're going to have to make a motion because we had a motion in place prior to override that one.
I make a motion that we go for the Quest outsourcing or retail to get the biometrics done.
I'll second it.
Did that motion make sense?
Yes.
My question, I'm sorry, we got to finish this. You want to vote, Mike?
Hang on just a second. You go ahead and talk for a second. I'm writing this out.
All right, while you write that, my question is, have we already earmarked money for the on-site stuff?
We should have, because that motion was made, and we were that was supposed to be in the works, and we were just waiting on that lead time window to get that started. And I think with everything that was going on, that was
back in February, right?
It was back
February,
in like January.
Yeah.
Well, I knew it was the first of the year, but since we've been put in this position and we've already lost 3 months, I say the best way to make up for it is to move the deadline back and let's go with this Quest retail deal and see if we can't get a bigger. Who's to say we might not even get a bigger participation through this?
That's a very good option. I mean, that's a good possibility, Mike. I mean, especially, it's like we talked about before, opening up some of the minute clinics and everything like that through Hy-Vee. And, we didn't get to move into that as quickly as we wanted to. But, with dependents and spouses as well, this could open up a huge opportunity to capture some more data for us.
Yeah, and I'm always a big believer the more data we get, the better we can run the plan.
Yep. So I have a motion from Mike Labor, seconded by Jamie Franklin, to move the HRAs from the on-site clinic to the retail option with Quest. All in favor, say aye.
Aye.
Motion
now,
approved.
Can we also put in a request that as soon as this information gets to the city manager, that we recommend this happen as soon as possible?
I'll include that in the recommendation, and I'll talk about the delay that we've had because of the COVID restrictions and everything like that, we maybe kind of try and fast track this so that we can get the information to Cigna, and they can coordinate it with Quest, and we can hopefully get this information out here in the next 30 to 45 days to all the plan members so that we can start moving forward.
Sounds good.
I think that covers everything from our old business. New business. I believe we have 2 presentations from Cigna. The first one is going to be over the Embark Benefit Protection Gene Therapy Program, and I will let Julie talk about that. And everybody should have gotten the pamphlet or the slides to go over it. I think Julie sent that out the other day, and she also sent out the annual one that she'll talk about afterwards. So, Julie, it's all yours.
All right. So I'm going to try to walk through this as quickly as possible, but please stop me if you have questions. And we're talking about gene therapy as well as a program that Cigna's put together called Embark Benefit Protection. So I'm going to go to slide 2 if you have that in front of you. So really, this is a little bit of background on gene therapy, so you're aware of what's going on out there. Gene therapy is a really cool thing in that, you know, there are some life-changing benefits and treatments out there, and many of them are one-time treatments. So what Cigna has done is, you know, we pay attention to the drug pipeline, and we're trying to really think about, you know, what are some things that we can do to help our clients and our customers out there to proactively look at what's coming and what can we do to kind of manage those potential costs as best we can, while still, you know, keeping in mind that we want to make these available to people. So what we've done is we've actually identified 2 specific gene therapies that are going to be under this Embark Benefit Protection Program. And these are set to likely come out in the July-August timeframe. One of them is called Luxturna, which treats pediatric blindness. And so you can see the cost there. So kind of the good and the bad about gene therapy is that it's curative. A lot of these that are coming out, but very, very expensive. So this one is $850,000 for treatment. And then the other drug that has been identified for this program is called Zolgensma, which treats spinal muscular atrophy, and it's $2.1 million for one-time treatment. So if you all happen to have anyone in these particular categories who qualifies for this kind of treatment, that would be a really big hit to the plan. And so that's a lot of why Cigna really started thinking about what can we do to try to help. A little bit more background on gene therapy. What we're seeing right now is there are about 18 different therapies that are in the pipeline that are probably going to get approved in the next 2 to 3 years. So in the chart on slide 3, what you see is for 2019, we had about $282 million in gene therapy costs and projected to be almost $9 billion in 2024. So this stuff is coming really fast and really scary, again, from the standpoint of plan costs. Really exciting from the standpoint of curative, but wanted to make sure that we're planning ahead for that for you guys. So slide 4. There's really 2 different things to talk about here. One on the left is our approach to gene therapy. So this is already in place. It happens regardless of whether you all have Embark protection or not. But what we've done is said that gene therapy is going to be in network. So that really helps with managing the costs. And we've got specific providers that are participating. We're providing a travel benefit if somebody has to go to one of those in-network facilities or providers. And then we look to the plan to tell what the cost share is for the member. And then we have a specific team that's dedicated to gene therapy to best manage that and work with the member and family as they walk through that. So all of that's in place regardless of whether you guys pick Embark or not. So what Embark does is it says for those 2 specific gene therapy treatments, Luxturna and Zolgensma, you all would pay 99 cents per member per month. And there's also, I'll show you in a few slides, there's also a credit that comes through that will minimize the cost of that. What that does is it means that for the actual drug itself, there's no member out of pocket for that. The only thing that they have to pay for is normal kind of plan costs for facility and providers. And the plan doesn't pay anything in addition to the embark charges for the actual drug itself. So when you look at the cost of this for 6 months for you all is $8,000 compared to $850,000 or $2 million. It's a type of insurance so that you don't have those dollars hit the plan. So I'm going to skip now to I'm going to just go back to the cost page. Certainly, if you guys have other questions, we can talk through some of it, but I'm trying to kind of get to the guts of it. If you go back to slide 10, slide 9 is kind of a general. I'm in the appendix. So let me give you guys a minute to get, because I flipped through a whole bunch of pages. So if you look at slide 10, you all have 28 members, and this is for the active employee population. This is not for the retirees. So approximately 28 members. And then I mentioned that there's a stop loss credit of 54 cents. So your actual cost is 45 cents per member per month, and it's only for 6 months. So it's just a little under $8,000 for this protection. So this would be the protection from 7/1/20 to 12/31/20. And then 1/1/21, we will be rolling that into the stop loss. So this is kind of an initial launch cost. We also have the ability, we've come up with this cost based on a Cigna book of business. And what we'll do at the end of the year is look at how much it actually cost. And if that is less than what we have predicted, then there's a potential for some surplus to be returned. So it would be kind of like how you guys currently get pharmacy rebates. There would be a potential here. With this particular example, there could be $5,000 returned. We don't know if that's going to happen or not, but there's the potential for that. So I'll pause and just see if you all have any questions about the program.
So Julie, this is Mike again. And I know Cindy and I and Terry have been to several conferences over the last few years when they really start talking about gene therapy, and it's actually an amazing thing of what they can actually do. And as far as when they get into the prescriptions, they can actually really narrow it down instead of having to try different drugs for everybody. Right. They can narrow it down to specifically what you're missing and get you the correct dosage and the correct drug at the time. With this plan, or this Embark Benefit Protection Plan, it only talks about the two current drugs that are currently FDA approved, and you say that there's somewhere around 18 therapies that could be coming down the pipeline over the next few years. When we start seeing those therapies increase as far as FDA approval, does that cost per member per month go up to include those, or is it kind of an umbrella of this is what we're going to pay to cover all the gene therapy over time?
So Mike, I don't know the answer to that. I don't think Cigna knows yet, because we don't yet know what additional drugs we're going to pull into this program. So there are other gene therapies out there that could come in during the 6-month period. We just picked these two as ones that we wanted to cover under the program. So I think, this is a new thing for us. And what we'll do is continually assess it, determine what other drugs are we going to put in, and then what's the cost going to be? So I don't know the answer to that question. You all would have the opportunity upon renewal to make a different decision if you decided, just like you do with, any of your programs. You can bring something on new if you want. So we know at the time of renewal kind of what this looks like for next year and what your decision would be.
So basically what we're looking at right now, just so everybody's clear on the committee, is that what we're looking at as far as the protection plan from Embark right now will only take us until the first of the year, and then we'll have to sit down and look at it again to renew that for 2021. Is that correct?
Yes.
Okay. Comments, questions, concerns from anybody? This is the quietest I've ever heard this committee.
Yeah, no, I think it's necessary for sure.
Yeah, I do too.
Yeah, it's pretty reasonable insurance plan for what could be just devastating costs for us.
Yeah, I mean, I agree. I think it's something that, if even one of these were to hit the plan in the next 6 months, financially, I think it would come close to ruining the plan. Any other comments, questions, concerns? If this is something that the committee wants to do, we'll have to make a motion so that I can send it to the city manager's office because there is money being spent as well. So we'll have to get a recommendation to him so that he can approve it and get it over to finance so that they can get this taken care of and get it all coordinated through Cigna.
Isn't this already being done? Isn't this the one that was approved, Mike?
This was the one that was starting to be approved, but it was put on hold because the Staywell committee has to make this recommendation. Nobody can just go on and do it. It's something that has to come from the Staywell committee as far as a recommendation. And my understanding of how things are supposed to be run, and we stay on par course of the way we've conducted business for since this committee started.
I'll make a motion that we purchase this from, I guess, July to December and reevaluate it at the end of the year.
I second it.
Okay, so the motion will read to send to the Staywell committee to make the recommendation to participate in the Embark Benefit Protection Program from Cigna at a cost of 45 cents per member per month through July 1 of 2020 through December 31st of 2020. That sound good to everybody?
Yeah.
Yep.
Yes.
Okay. All in favor? Say aye.
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 Motion approved, and I will get that sent to the city manager. The next order of business under new business is that will be the summary for the plan for the last year from Cigna as well. So I'll turn it back over to Julie and let her talk about that.
Okay, thank you. So I sent this out last night. And you all are getting the very, very short version of this, and probably Mike and Cindy and Alicia will say, good for you. We had a lot of slides in this presentation, but it's typically very data driven. But what I wanted to do is just really roll it up for you guys in a summary form. And certainly, if you're interested in additional detail, we're happy to provide the full report to you. Excuse me. So I'm going to go to slide 2 in that presentation. And so just a few themes that we saw, and you guys have been around for a while, so these were probably not new to you as they weren't necessarily new to us either. but we're seeing, and these are specific to the city. There are also things that we see among our other clients also, but we're seeing a higher rate of obesity and diabetes. And so, we look at when we do our annual strategy meeting each year with the city, we pull your data for the last 12 months and we compare it to other similar city and governmental entities. And so when we say the norm, that's what we mean. So what we're seeing is a higher rate of obesity and diabetes. And so you'll see in our recommendations that we have something there. Because the real point of this meeting is to talk about what happened, why it happened, and then what can we do about it. We also see that engagement is increasing. However, it's still below the norm for those members that have chronic conditions. And so, as you all know, those are the members who are expensive. So we've got some things that we want to talk about related to that. And then behavioral health is a focus as well. I think, Cigna is an organization that really looks at the whole person, body, mind, spirit. So you may have seen earlier this year some of our commercials, but we really do focus on how behavioral health impacts overall health. And so I think there's increasingly more awareness of behavioral health issues. And I think in particular, we've seen this with our clients especially in some of the first responders that we work with. And then this is not new either, high-tech radiology, just, very expensive to go in and get those MRIs. And so we see that happens with our clients. And so we work to try to educate and, put in place programs to help manage those costs, because as you all know, sometimes a old-fashioned x-ray may actually really work. And it's, about $25 versus an MRI is around $2,000. So we want to make sure people get the care that they need while at the same time, being good stewards of the city's and Staywell's money. So those were some of the things that we saw. Page 3 in the slide deck, I'm just going through some of our recommendations. And so what you see there, some of these are have some dates associated with them, and some of them don't necessarily. So one of the things that we talked about was that with the focus on behavioral health, Cigna does have an employee assistance program, and it aligns with the providers that we have in the medical plan. So it really allows, if you all have Cigna's EAP, it really allows for a more seamless transition. If somebody's in the middle of care through the EAP, they can get started with the Cigna provider and stay with that person through the process once their EAP visits are finished. So that's something that we've been talking about maybe implementing in July. We actually have a focus on first responders, and we have some very specific things that we can do in that arena. So that's something that's been discussed. I'll talk about OMADA a little bit, and then Mandy may chime in if with some specifics if necessary. But OMADA is our diabetes prevention program. And so this is a program where the cost of it is kind of unique in that it's really runs through as claims. So if someone is identified and then actually does go into the OMADA program, it's a 2-year program. The first year, the cost is $235 per participant plus $13 per percentage weight loss in year 1. So it's really a program to help with weight loss, because that does drive many of the things that we see related to diabetes You all had about 100 people who are classified as pre-diabetic. And then there are people with high cholesterol, high blood pressure. So feel like this is a good program that could focus on that group of people. And, we do see what we're trying to do is get to people before they get to diabetes, because that really helps with long-term cost management and better health for them. We also have, and I'm going on page 3, I'm going from left to right, so a program called Save On SP, which is really has to do with utilizing when somebody's on medications, just making sure that we're administering the plan as intended and that copays and co-insurance work the way that they should, even if somebody's got a coupon type of situation. So that's something to kind of consider. That's not available until January. And so really, Mike asked me to bring this stuff to you guys just so you know kind of what we brought up. And then as you all are thinking through what your decisions may be for the future. So we can talk in more detail about these. And then another thing that was discussed actually last year, but it was later in the year, so not really available, wasn't discussed early enough to do for 1/1, but currently you all had for your HSA, and Cigna actually has an option called HSA Bank. And what that does is it really allows and aligns with the desire to encourage people to be on that high deductible health plan. And it works really well with MyCigna. When you get on MyCigna, you can see how much money you have in your HSA. You can easily pay claims. There's a whole bunch of stuff that works really well when it's integrated that way. So that's another thing to think about for 1/1. And then on the bottom left-hand side of page 3, we talked about, we have an enhanced customer service model, which is really kind of concierge type service. And that's something that we call a One Guide, which allows even greater participation and engagement in things like, for example, OMADA or the EAP program, or making sure that people, answer the phone when Cigna's calling them to participate in some of our care management programs. So just an overall enhancement of service. And then we talked about, and this may be something that could happen later on in the year, but we saw with preventive care on the dental side, and as you all may know, dental health really does contribute to overall health. We saw that preventive care really wasn't happening at the rate that it needed to happen. And so we've been doing some on-site dental events where people can actually go and get their preventive care done. And of course, that's something that kind of went off the table with COVID, but people are starting to think about doing those events again. They certainly are well aware of how to do social distancing and all of the different, disinfecting and so on. But that's something that's been really popular. So it's just a convenient way for people to get that care done. And they would utilize their Cigna insurance. So it's a pretty easy thing for the city to do and facilitate. So that's another thing that we talked about. On page 4 of the slides, there's a lot more detail on, all of the different recommendations, but I didn't want to bore you guys with all kinds of detail on this stuff, but 4, 5, and 6 do provide that additional detail. So again, Mike wanted just to get a summary of that meeting to you all, what some of the recommendations were, and then you know, I'm open to any questions that you all might have.
Thank you, Julie. I know it's a lot of information to digest. I think our meeting that we sat through on this was, I think it was somewhere around 3.5 hours when we actually sat down and talked about it back in February. So by all means, this is not something that we have to, if you have questions or you want to review over the next 30 days before we meet for our June meeting, I'm sure that we can put this back on the old business as well for next month. If anybody has any questions, comments, or if they want to see any further presentations that, on some of those plans and how they would affect our overall plan and the health of our plan from that standpoint. So, questions, comments?
I'm losing volume. I can't.
I had a comment on the EAP program. This is Terry. We did a RFP, you know, request for proposals, and for the EAP program, and we got Support Link or Cure Link, and we have an agreement with them for October 1st, 2018 through September 30th, 2021. You know, we had a review committee, and all providers were welcome to submit bids. And so we have an agreement for an EAP program already. I mean, we will have to bid it out next year early, but we have a bid process. It seems like that would be duplicating what we already have, but Cigna could bid on it, you know, for the next RFP for next year.
I think this program, if I'm not mistaken, Mike, wasn't that the one we kind of talked to go along with behavioral health? And so it's kind of for people that maybe are uncomfortable doing the city's EAP, but we would have to delve into that a lot more. And I think that would be a good conversation that we need to have with Brian and maybe Adam and this group on where we're kind of going for the behavioral health.
And to reiterate a little bit about what Cindy was talking about is that part of our meeting that we had in February had to do with behavioral health and kind of expanding that program a little bit further than just EAP as far as inpatient programs and treatments for individuals. The City of Independence we are uniquely diverse. With first responders, our police officers, we have a huge category of veterans that have served countless times throughout their lives. And I can tell you firsthand from experience that the city's EAP program for me did nothing. Just for the simple fact of that, trying to find somebody to talk to that understood my situation and what I did and what I do for a living. I got more into the position of somebody trying to hold my hand and thank me for my service than trying to get any benefit. And I was lucky enough to find somebody eventually that was able to understand what I was going through, that was part of the city's EAP program. But, you know, this had gone on for 6, 8, 9 months. And for somebody that's going through some type of crisis in their life, whether it's PTSD or an addiction or anything along those lines, they may not have that long to wait before something happens. So that was something that was discussed. And like I said, unfortunately, the restrictions and the pandemic that's happened have kind of put a squash on some of those meetings and those conversations. And I think it's like Cindy said, we need to continue having those conversations with Cigna and kind of figure out what we can do that's going to best work for our population in our city. Because it's like Julie said, mental health is huge right now. And it's being accepted widely across the U.S. and across the world. And I think it's something that if we can help our members with that process, it's one less thing that they have to worry about and something that they can feel safe and feel like they can reach out to.
Mm-hmm.
Hey, if we were to implement what is recommended in this, I think there's 1, 2, 3, 4, 5, 6 different recommendations. What kind of hit financially would our plan take by implementing these?
So OMADA would be a minimal cost, and that would go through claims. So that's kind of based upon participation. The EAP program would, if you all replaced what you have today, you know, you all would have to do the kind of what's the difference in cost and all of that stuff from what we bid. On HSA Bank, again, I don't know what you guys are currently paying, UMB. Ours is $4.50 per employee per month for people who have that. One guide would be $3.50 per employee per month. The dental would be just claims. So, you know, it's just a different way for people to get their dental done. So I don't think that's an impact. And then Save On SP, there's really not an additional cost for that. It's just a different way of looking at how to run through and manage when you've got coupon or copay assistance through the pharmaceutical companies, how that kind of happens in the plan.
I think that we would need to, I'm kind of like Mike, I think everybody kind of needs to review it. And then if there's ones that kind of pique interest, that we would come back and get more detail on the program and then kind of decide if there's things that, you know, is worth us trying to add.
I think this is something that we have a little bit of time. I know it says implementing the Cigna EAP plan 7/1/20, but if we're currently under contract through our current EAP provider until September of next year, there's not much we can do without having to eat some type of cost. And I don't know if the city's willing to do that with our budgetary issues right now, or if I have to wait. And then that's something that we look at towards the end of next year when that contract is up. But if everybody kind of wants to take some time and read through this and the recommendations on pages 4, 5, and 6, then that's something definitely that we can bring up. I'll have Alicia put it on the agenda for the June meeting, and we can have some further discussions on that. And then if there's anything that we want to see a presentation on or anything like that, we can make those requests at that time.
Because Julie, isn't there, even though some of these are at a cost, some of these should result in a savings to the plan, and I think they would need to see that full comparison.
Yep. You're right, Cindy.
Is everybody okay with kind of chewing on this?
I'm good with next month.
And we'll sit down and really divulge into it next month. I know we've covered a lot of information this morning, and I'm trying to get caught back up from 3 months, and I don't want to. I just want to make sure we're doing our due diligence on reviewing all this material as well. Does anybody else have any new business? None?
Hey, could I get an attendance? Who all's here on this?
So if you click on, there's a tab down there on the bottom on my iPad. It shows like 13 plus. So it's the 4 that are on your screen. You can click on that, and then it pulls up the very top. You can see there's like 2 little people up there. If you click on that, It'll take you through and it'll show you all 17 members that are in the meeting.
Okay, I see if you click on the little circles, that tells me also. Okay,
Yep.
I'll do that then. And I also need to talk to you, Mike, after the meeting for just a few minutes on some of the notes.
Yeah, if you want to just give me a call on my cell phone, I've got someplace else I need to be. I can discuss that with you at that time.
I had a urgent call like during that discussion on the genetics information, and unfortunately, I'll call you then on that to get those notes. Okay.
Yeah, just call me on my cell phone because I'm at home today. So.
Okay, thank you.
Does anybody else have anything else? Hi, Izzy.
She says hi.
You start bringing her to our meetings. She could be our therapy dog, our calming therapy dog.
She was sleeping through most of it, but then she's like, I need to get on your lap.
Yeah.
Mike, what's the plan next month? Do it on Teams again?
My understanding is that June 1, and Brian, I think you're on here as well. Correct me if I'm wrong. June 1, the city buildings will be able to start opening back up and everything like that. And if we stay in the current phases, I think we're getting ready to move to phase 2. That we will be able to gather and meet in person for that meeting. We'll just have to maintain some social distancing. So.
I would say if you wanted a bigger room, and I don't know if Jim's still on here, but the lunchroom out at our service center by the power plant, we could probably all sit 15 feet away from each other in that place.
Okay. Yeah, we'll kind of have to wait and see how things go as far as the restrictions and what phase we're in as far as the city and the county and what we're following and everything like that. But I'll get with Alicia here in the next couple of weeks as we progress and make sure you guys have plenty of time and ample time if we need to move our meetings or anything like that. Also, at the same time, we'll work with anybody that doesn't feel comfortable being in the area or getting out of their homes at this point. So we can go from there and work that in as too, and maybe have some call-ins as far as the team's meeting as well.
Yeah, we also have 117 here at the IUC building where they do the onboarding. That's a pretty big room.
Is that downstairs? That one?
Right. The one on the first floor.
So yeah, that's something we'll kind of play it by ear and discuss. And I'm not sure how things are going to change between now and then. Like I said, we've got about a month, so we'll just watch it and we'll go from there and make sure everybody's got ample lead time to make arrangements if they need to.
Oh, Mike, you want to hit one other thing, just so that they know that we discussed with the city manager that there would be no changes in the plan. Do you want to hit that real quick?
Yeah, I apologize. I forgot to bring it up. Thank you, Cindy. So if everybody remembers last year, the city manager asked for kind of a budget proposal for last year when we were going through the budget processes and kind of wanted to talk to the Staywell committee and find out and along those lines. So back in beginning of March, first part of April, I emailed Zach and asked him, how he wanted to proceed with everything that was going on, any planned healthcare changes that we were potentially looking at from the city. And I was told from Zach in an email that the plan for the next budget year, 2020 through 2021, would remain status quo. So we're not anticipating any changes or anything as far as our healthcare, as far as premiums or plan members or anything like that at this time. So it sounds like we're just going to maintain where we're at right now.
He does want us to continue looking at possibly increasing money to get people to switch to the OAP2. Is that correct, Mike?
Yeah, he wanted to look a little bit harder into the wellness program and some other ideas of how we could drive some of our plan members to the high deductible plan. Fortunately, we've got a little bit of time on that because we won't start really reviewing any of those plan changes until like August, September, so that when we go to open enrollment, everything's ready to go. So hopefully open enrollment will be a little less hectic this year than what it was last year with all the plan changes. So we'll have a little bit more lead time to look into that as well.
Well, the sooner the better, because that has to go through council for 2 readings, and and we have to prepare our open enrollment information and get that implemented in October or sooner, in September, really.
Okay.
So if there's any
That's something we can start looking into in July and August to make sure we try and get everything going by then. It's going to be a little bit difficult to try and get, the hurdles of what we're facing as far as the pandemic and the restrictions are going to be the only thing that kind of limit us on what we can try and gather and get information, but we'll do our best to do what we can.
Yeah, I was going to ask, since you said it was going to stay the same this year, they encouraged by giving some money to OAP2. Are the people who are on it, is that money going to be deposited into their account again this year, or do we know that, or
should?
Well, that money was deposited January 1.
Yeah, for next year, though, since you said nothing was going to change.
That is something that we're going to have to sit down and discuss with the city manager and kind of go from there. Izzy.
I think that was the indication, though, with it staying the same. He just, I got the feeling from what he was saying is that he just wanted us to look at, what we could do to actually even increase it even more.
Okay. All right.
So if nobody else has anything else, do we have a motion to adjourn?
Second.
Well, I can't make the motion. Somebody else has got to make the motion.
I'll make a motion
to adjourn.
This has
been entertaining.
Jamie's made the motion to adjourn, seconded by Mike Labor. All in favor, say aye.
Aye. Aye.
Thank you, ladies and gentlemen. I hope you guys have a wonderful day and a great week.
Good to see everyone.
Thank
Stay
you.
safe.
Bye.
Yeah.
Bye, guys.
All right. Bye-bye. Is it?